Today we're going to talk about what to expect after you've had the baby and you're at home coming up. So I get a lot of questions about sort of what's normal after you've had the baby, and so we're going to talk about some of those today. You know, one of the first things everybody asks is, how long am I going to have this bleeding for? It typically goes about a month, but it could last even up to 6 weeks. Sometimes when I see people back in the office at 6 weeks, they're still having a little bit of bleeding. And if you're not nursing, then you might have even had a period by then, although good chance that you wouldn't have. If you're nursing, you might not have a period at all once that initial bleeding stops, and that's because nursing typically suppresses ovulation, and so you won't always have a regular period. Now, it's no guarantee that you couldn't get pregnant. You still could, but it is less likely while you're nursing, especially in the early several months when you're exclusively breastfeeding and no supplementation at all. Heavier than soaking about 1 pad per hour after you've gotten home would be unusual. So heavier bleeding is worth seeing your doctor for. Sometimes it could indicate there's a little retained placental tissue, and that does on occasion require treatment with a little surgery called a DNC. Another thing people ask me a lot is everything going to be normal down there after this is all over with, or when is it going to go back to normal down there? And the answer is that, you know, the vaginal tissue and the muscles and the perineum and all that, they do slowly contract over time, and typically by the time we see folks back at about 6 weeks postpartum, things are looking pretty normal and the vagina has returned to sort of a normal opening size. Although the perineum itself, if there's tearing, there's still going to be some healing, maybe still somewhat tender, and it may never look exactly the same as it used to before having the baby, but that's okay. I mean, this is just a normal part of the process, and for most people, it doesn't cause any long-standing problems. People ask a lot if they had stitches, what are they supposed to do with the stitches? In any particular care, anything you're supposed to do with that? And basically, I tell people you can take a bath, you can take a little shower, use a little squirt bottle after you go to the restroom, and just kind of pat the area dry. You don't want to do a whole lot of scrubbing or anything. You might loosen the stitches up if you did. You might even tear a little bit if you did. And the other trick is that if it's tender to touch, especially in the first few days, but you just want to get dry, then you could use a hair blower, a hair dryer, just set on the cool setting and just kind of blow things dry. That's okay too. You know, I've got this laxity here in the abdominal wall. Maybe even there's some separation, kind of a bulge here in the middle. So that's called rectus diastasis. And for most people, that laxity in the abdominal wall, sort of the stretchiness of the skin, goes away within a few weeks to months. But the rectus diastasis, it may be permanent. It's much more common to notice it in thin women just because there's not as much cushion there between their muscles and the outside world, and so that bulge is more prominent. There are some physical therapists who can help with that, and occasionally people actually have surgery to try to repair it because it's so bothersome. My advice on surgery would be wait, of course, till you're done having kids, because if you have another baby, it's probably just going to come right back. Hormones. When are my hormones going to get better? These hormones. Well, the pregnancy hormones specifically, they return to normal levels over about a month. Although you may still feel bluesy, you may feel tearful, just crying for no apparent reason sometimes. That's pretty normal. And the one thing that I tell people there is that, you know, if it's impairing your ability to function, that's where, to me, you need to think about, well, this could actually be postpartum depression. You know, if you're having basically a hard time getting out of bed, no motivation to really do anything. In those situations, that's starting to sound more like depression, not just the blues. And in that situation, you're probably better off talking to your doctor about that one. Also, hot flashes are pretty common. They tend to last for the first few weeks and then tend to just go away on their own. So a few comments about skin and hair. Stretch marks, really common, of course. They start off kind of bright red when you're pregnant, and then after you've had the baby, they kind of fade to more of like a flesh tone or even sort of a silvery color. Stretch marks are permanent. We tried in the office like some laser treatments and stuff. It doesn't really seem to help very much. Unfortunately, there's no good cure for stretch marks. It's basically just where the skin has been stretched to the point that there's a little scarring that occurs, and that's what you see in those silvery layers, and there's just nothing you can really do about it. Some people swear by cocoa butter or vitamin E lotion. I think it's fine to try it. I've never seen any studies that said that it helped at all, but I definitely don't think it's going to hurt anything. So, give it a shot. The one other skin question that people talk about is that mask of pregnancy. So it's called chloasma. It's where you get darkening of the skin kind of in this area. And that does tend to fade. It takes several months, but for most people it does tend to fade over time. It's just a direct result of high levels of estrogen when you're pregnant. It just causes the skin to get a little more pigmented. Hair loss. People come in all the time. They're like, I've got clumps of hair coming out. And they basically, hold you a handful of hair and show you, look at all this hair. It's totally normal. And the main thing to understand is it's not permanent. So it's not like the hair follicles where those hairs came out of are dead. What has happened is the hair follicles when you're pregnant tend to kind of go into a dormant phase and they just stay there. And then when you've delivered, that kind of clicks back on, and a lot of the hair follicles go into, it's called the telogen phase, which is where the hair sheds. But the hair follicle's still there, and it will kick back over into the growth phase, but it can take several months. So it's not one of those things that we go, well, 6 weeks and it's all good. It can be several months before a normal pattern returns. So don't worry, it's not a permanent thing, and virtually always goes back to normal over time on its own. Another thing that we talk about, especially immediately postpartum, is trying to prevent blood clots. So pregnancy is a time where the risk for a blood clot is up to 80 times higher than in the non-pregnant state. So delivery and postpartum are the most common times when you'll see those. However, they can occur even before the baby's born. So, anytime you have one leg that is swollen and painful, now the other leg's not affected, you need to worry that it could be a blood clot. The best way to find out is to have an ultrasound of the veins in the leg. You can see the clot if it's there. There's some things that we do to reduce the risk. For example, if you have a C-section, we use these little sequential compression devices that kind of squeeze on your legs while you're in surgery and for the first 24 hours or so after delivery. We don't use those in vaginal deliveries because they just haven't been shown to be effective. We recommend, we call it early ambulation. So getting up and walking, even like the night of the delivery, the few hours after delivery, whether it's a C-section or a vaginal delivery, pretty much as if you had an epidural, as soon as the block has worn off from your legs and you're able to bear weight, it's really important to get up out of the bed and start moving around. And that can be painful if you've had a C-section, but it's really important because the risk of blood clot is significant, and it can cause other problems like pulmonary embolism, where that blood clot breaks off in the vein and actually travels up to your heart, flips over into your lungs, and that can be a life-threatening problem. So it really is important. So if you're sore and you're tired and you don't really want to get up, it's really good advice. The nurses can help you get up and move around, and it's one of the best things you can do to reduce your risk. There's a few breast issues to talk about. So the most common one the two most common are breast engorgement and cracked nipples, and then the one that people worry about a lot and does happen fairly commonly is mastitis. So there's three things to talk about there. The breast engorgement thing, it's really common. It's usually in the first few days after you've had the baby, and it's sort of like all of a sudden the milk supply kicks in, and holy cow, breasts are hard as a rock, they're painful, and there can't even be just a mild temperature elevation. Shouldn't be a real fever like 101 or higher, but 100.5, 100.8, you don't typically see it much higher than that. So if you have really firm, hard breasts and you have a little bit of a low-grade temperature elevation, but you otherwise feel okay, it's probably not mastitis, it's probably breast engorgement. Interestingly, it just typically takes care of itself. There's really no specific treatment. It's good to pump, and you can kind of pump until the breast is sort of empty and you get some relief, and that's fine. But even if you just kind of nurse the baby like normal and just sort of grin and bear it typically just takes care of itself. So that's not one to really worry about. I know it can be very bothersome, but the bigger concern for a lot of people is often, is this actually mastitis? So let's talk about mastitis next. The big difference between mastitis and breast engorgement is the mastitis hits very suddenly. It does not typically happen in the first few days after delivery. It's usually, several days to weeks down the road, and all of a sudden you just feel like total crap, high fever, shaking chills, 102, 103 fever or higher, and just feel like you've been hit by a truck. Your whole body can ache. It just feels awful. And then also you may start to notice a little area, one little wedge-shaped area on one of the breasts the skin is red. And so if you see this red skin. It's typically warm to the touch. It's usually kind of like a little pie-shaped piece, at least maybe that big. And associated with other symptoms, the high fever, shaking chills, just feeling like crap, muscle aches, stuff like that. That's pretty much a guarantee that's mastitis. I would encourage you to call. If you're in our practice, you can call us on the phone even at night. We'll call you an antibiotic. We'll see you in the office within a day or two to make sure you're getting better. But that's not one of those things you really want to wait and delay and be seen in a day or two in the office if things aren't getting better. You want to jump on that right away. Because if you let it go, it can get a lot worse, can get a lot sicker, and there's even a chance for things like abscesses and stuff like that, and that's just a whole different level of bad that you don't want to have to deal with. Now, the other common one is cracked nipples, and I think that's just from the trauma of breastfeeding, and babies have got their mouth on there, they're chewing around trying to figure out what's going on, and it's really not fun. I've seen some pretty beat up breasts when people come in to show and they get this big crack, and it's really annoying, and I know it's painful, and I always feel so bad when you see it. The first thing I tell people is have a lactation consultant take a look at how the baby's latching, because sometimes there's some things they can do to help you there, and it may take care of it. Occasionally I recommend nipple shields. They very often recommend this stuff called Newman's nipple cream or Meta Honey, and I think they're fine. We call them in all the time for patients. But interestingly, when I read more about this, it turns out that nipple cracking usually just goes away on its own within about 7 to 10 days. So it's not wrong to just try to ignore it and see if it goes away. And if it's not getting any worse and then it starts to get better, then I think fine, don't worry about it. But if it's persistent, then I'd definitely see lactation consultant and maybe think about using either the nipples, Newman's nipple cream or the Meta Honey. And for some people, it seems to help quite a bit. Okay, so just kind of working our way down the body here. So talk about the bladder a little bit. In the first day or so after you've had a baby, especially from a vaginal delivery, it can be difficult to empty your bladder completely. And that's probably just from the fetal head pushing down into the pelvic floor. There's some nerves there. We'll put a graphic up here to sort of show you what I'm talking about. But there's some nerves that kind of run through the pelvic floor, and that head's just sitting there compressing on them. And that pudendal nerve also supplies innervation to the bladder. And so it can lead to some voiding dysfunction. It's usually temporary. It's usually 24 hours or so. If you feel like you're not emptying your bladder, that's really important to let the nurse know that's taking care of you at the hospital. Occasionally what we'll do is we'll put a catheter in overnight, just let your bladder rest, and that almost always takes care of it. If it seems to be lasting longer than that, then we do have other options, and we can teach patients how to catheterize themselves just sort of in and out to get the bladder emptied. It usually goes away on its own over time. You don't see it being persistent more than 24 hours very often, but you do see immediately after delivery sometimes people having a hard time emptying their bladder. So that's one of those things that the nurses are always looking out for, but it's smart also for yourself to be aware of that issue. Now, more common after you get home, and maybe even before you had the baby, leakage of urine when you cough or sneeze. That's really common. Fortunately for most people, it gets better over time, especially if you do the Kegels exercises where you kind of squeeze the muscles of the pelvic floor. For some people, that helps kind of rehab the muscles around the urethra, give better support, and leads to less leaking when you cough or sneeze. Unfortunately, some people it is permanent. It seems to be more common in people who've had several vaginal deliveries. It's less likely that you'll see it in someone who's had only C-sections, but it's not impossible. I have seen it. Unfortunately, there's not a whole lot you can do beyond the Kegels other than surgery. And the good news is surgery is very effective. It's an easy outpatient procedure. It's got very good success rates, long-term, it appears to be safe. It's a surgery. You gotta go to the hospital and have it done. And it's best to do that one after you've completed having your kids, because if you had the sling and then you have another baby, it's probably just gonna wreck that repair, then you're back to that same problem again. So I'd wait until you're done having kids to fix that one. Hemorrhoids, really common. It's mostly just about local care. There's all the different creams, Preparation H and Tux and witch hazel and all that. There are some prescriptions we can call in if it seems like the over-the-counter stuff's not doing it. You can have them fixed surgically after you've finished having your babies. And then people ask all the time, like, when can I start working out again? when can I have sex again, when can you use tampons, stuff like that. So we generally recommend no sex, no tampons for 6 weeks. It's arbitrary. One of the problems is if you had a tear and you had some stitches, those stitches are still hanging around for about 6 weeks. You probably haven't healed completely. I would expect it would be uncomfortable to have sex, and if it's uncomfortable, my advice is don't do it. You're probably still healing, and there's a chance that you could tear back through your tear. You could pull out some stitches, stuff like that. But if you didn't have a tear, if you have no pain, then I think from that standpoint, it's probably fine. The only thing I will say is, if you haven't been in the office yet to talk about birth control, you could get pregnant, and I've seen it happen. So we usually tell folks no sex for 6 weeks. We'll talk about birth control when we see you back at your checkup, and that's just kind of a conservative way to go. But if you feel fine, you didn't have a tear, and you want to have sex sooner, my advice, just use protection. The other one people ask about a lot is, when can I start working out again? And generally speaking, returning to normal activities of daily life, basically if it doesn't hurt, it's fine. And that's especially true for vaginal delivery. You do have to take it a little bit easier, obviously, if you have a C-section. Probably shouldn't do real heavy lifting. We arbitrarily sort of say no more than 20-25 pounds for about 6 weeks. There's no data to tell you based on this study or that study that this is what you should do. This is just kind of what we've always told people. It's probably very conservative. I tell people that that's the general guideline, but basically if it doesn't hurt to do something, it's probably fine. I don't think you're going to have a problem. And then as far as like exercise goes, especially from vaginal delivery, if it doesn't hurt, it's fine. So I encourage people to be active. It's good to get outside, take the baby for a walk in the stroller, get some fresh air. Nothing wrong with that. It's good to get some vitamin D from the sun, and it's good for your mood. It's good for your sleep-wake cycle if it's all messed up from being up with the baby. So I think there's a lot of benefit to physical activity. I encourage everyone to be as active as they can, as long as it's not causing pain. Okay, well, that's everything that I wanted to tell you today about postpartum instructions. I'd be happy to answer your questions if you put them in the comments. If there were topics that I did not cover, please put them in the comments. I'm always looking for new ideas. I really appreciate everyone's feedback. I really do want this to be a community. You'll probably notice on some of the videos that there definitely are conversations after the video is over. There definitely are back and forth questions between patients and myself, between individual people talking back and forth about different things. So I really do want this to be a community where we can share ideas and information. So if you have questions, please put them in the comments. If you like what you are seeing, if you would like to see more, please consider subscribing. You can check me out also on Instagram. I'm on Facebook. I'm on Twitter. So you can check out those different venues. I will often post updates to those that are quickie little reminders of a new video that went up or something like that. But the best way to find out is just to subscribe. And then there's a little bell you can hit. You'll get notifications when new videos are posted. That's the best way to stay up to date for sure. Also, a quick plug, don't forget about the Vitamix Smoothie Maker. If you haven't seen it yet, there is a video on my video list. It's about 5 or 6 down from the top now. And if you have subscribed to the channel, and then if you put a comment on that particular video, you're entered for a chance to win. I was hoping to do the drawing on December 31st if I hit 1,000 subscribers. I'm only about halfway there. I know we can do it. So it'll hopefully maybe by the end of next month we'll have 1,000 subscribers and we'll do the drawing. It will definitely happen. I just want to hit that goal of 1,000 subscribers. So the way you can help me do that, share this information with your friends. Get them to subscribe. Tell them about the giveaway. Thanks to everybody for your continued support here on YouTube and also in real life. You know, I see people every day that saw a video and came in and we had a real life conversation, and that's always really great. And it's just another way to connect. So thanks again for everyone's support, and hope to see you in real life sometime soon. If you have other questions or comments, you can put them in the comments below. And thanks for watching, and have a great day.